I talk a lot about the power of the room when it comes to therapy and the power of being in a room with someone who is listening to you. And that power and the imbalance of that power can be as damaging as it can be illuminating. So it can definitely go both ways in the wrong hands.
Hey there, seekers. Before we get into today's episode, I've got a small favor that could make a huge difference. If you find value here and think others could benefit too, the best way to help spread the word is to scroll down and leave us a quick review, whether you're on Spotify, Apple Podcasts, or YouTube. It only takes a moment and it helps us reach more people striving to unlock their potential. Plus, you might even get some good karma. Welcome to The Self You Seek, a podcast dedicated to helping you unlock your fullest potential through self-actualization, mental optimization, and transformative experiences. I'm Dr. Brendan Doherty, a traditionally trained psychiatrist who has come to realize that while psychiatry offers powerful tools, there's often something more needed to help people truly thrive. In this podcast, we'll explore evidence-based approaches alongside ancient wisdom and modern transformative experiences that push beyond the boundaries of conventional mental health care. Whether grounded in science or supported by compelling anecdotal evidence, these insights and discussions are all worthy of exploration. Join me as we navigate the path towards unlocking your potential and transforming your well-being. And a quick reminder, this podcast is for informational purposes only and does not substitute for personalized medical advice. Always consult with a licensed healthcare or mental health professional if you're uncertain or need guidance. This podcast also does not represent the views of any business or health service I'm associated with. And now for the show. Hello, and welcome to the next episode of Recipes for Change in the Self You Seek podcast. Today is a very exciting and personal topic. It's called Talk Therapies, something that is close to heart to my co-host Richard and I. And I'm welcoming Richard again to the podcast. Pleasure to have you here. How are you today?
It's a pleasure to be here. Thank you for having me. I feel like I have been waiting for this podcast all series long, and I am very excited to talk about one of the main passions of my life, and that is talk therapy.
Wonderful. And for those of you that are not watching this on video, tell us about what you're wearing today and where you're sitting.
Well, I thought I would change things up for today and actually broadcast from the couch. So I am sat on a couch for that therapeutic feel. And for those of you who unfortunately are not seeing these two beautiful men discuss talk therapy, I'm wearing a t-shirt which says, "Let's all go to therapy," which is, again, a big belief of mine, but maybe we can get into that a bit more later on.
Looking forward to it. Well, let's get cracking. Today we're obviously focusing on talk therapies, and we're going to talk about what are they, a little bit about the different types. Spoiler alert, there are millions. Who would typically do talk therapies and the usual pros and cons list. And we'll probably talk about a few specific examples and then finish by how to go about finding a therapist or get into therapy. And hopefully sprinkle in a few personal anecdotes and experiences along the way. So, what are talk therapies? Well, they are kind of synonymous with psychological therapies. I say talk just because that's really the defining feature. They involve two people sitting down and talking about stuff. They can branch and do somatic therapies where there's hands-on touch, but that's pretty rare. And there's also some things like some fancy techniques like what we would call EMDR, where you're using your hands and looking around in different ways. But again, by and large, talk therapies equals psychological therapies. It's not talking about medicines at all. And it is distinct from coaching. Therapists who use talk are typically qualified and coaches are typically not. They will speak from experience. There might be qualified coaches, but in general, a psychologist or a counselor or a psychiatrist or someone with an allied health background or a nursing background even can go in and go to an institution and get registered to be a therapist of some sort. So that's one of the big differences. The other big thing is they are relational in nature. So they work a lot on the relationship between the therapist and the client. And that's actually where a lot of the change comes in, particularly with the longer term therapies. And I just want to remind people that our brains as humans are hardwired for communication. We are relational beings. It's probably why humans have done evolutionarily really well, is because we work in groups, and that's how we thrive. And that's what really the basis of talking therapies is. You're working in a dyad or in a group, and you're bringing up the stuff that comes up in that. You're talking to people and they're helping you to change. And one quick point, how does that relate to the success of the therapy? It's another spoiler alert, which we're going to talk about, that the quality of the therapeutic alliance really is dependent on the outcome of the therapy. Richard, does this bring up any early points for you?
I think the most important one there is the therapeutic alliance. It is probably the most important thing outside of maybe an openness to change that is the crux of successful therapy. Not all therapists are equal. I will go out on a limb and say that. Much like every profession, there are some great people, there are some not so great people, and I've been very fortunate in my life to have worked for a long time with an excellent therapist, two excellent therapists, but I've also been on the other end and had some not so great experiences. So yeah, the therapeutic alliance is key, and yeah, I look forward to discussing a bit more about that.
Yeah, and let's bring up one of these early points now. If you don't gel, let's say you get into therapy, we'll talk about this more later as well, but you get into therapy and you don't gel with that therapist, or they say something that rubs you up the wrong way, how would you approach that as a client, someone who might be coming to therapy?
Yeah, this is a very tough question because it takes a lot to go to see someone and to discuss personal, interrelational, work, financial, whatever kind of difficulties you're in. And to allow yourself to be vulnerable in front of another person is a big ask, and it's not to be downplayed or underestimated. And you are not you're not bound to stay with the first therapist you see. For all of those people listening out, there are hundreds and thousands of therapists across the world, all with different skills, different niches, different client bases. And much like if you're looking for, I don't know, a new partner or a new car or a new energy provider, shop around, find something that suits you, whether it's, it could be the gender of your therapist, it could be their orientational background, it could be what clientele they see themselves. There is, somebody for everyone out there, and it can be hard to find the right one, but again, I guess much like relationships, when you find the right therapist,
Yeah, I've heard it so many times that people will be suggested they go to therapy and they're keen to give it a go. They go and then they don't get on with a therapist. Actually, particularly in adolescents, because I work with a lot of adolescents, and they don't like the nature of the talk therapy. They don't like the therapist, and it is okay to switch. Like you should, if you really don't like the therapist, it's a good idea to not give up, because there's all sorts of different types that we've discussed. But also, if you don't like something about the therapy or it doesn't gel, the best thing you can do as a first step is to actually talk to the therapist about that. That can be quite therapeutic in itself, because a good therapist will be able to non-defensively work through that. And that might be healing in itself. But then if that's still not working, or you're unable to do that, or you need a gentler therapist, then just see another one. Don't say that therapy is not for me because I went to see one therapist. I had 2 sessions and like them. Nope, therapy is not for me. There are so many therapists, so many different types of therapy.
And just to round off on that, this is one for the therapists out there. Any therapist worth their salt, like you say, should not be offended by the fact that someone may not gel with them or may not like their approach, and should be able to bring it up in a safe and comfortable manner inside the room. But also, therapists have a huge responsibility to their clients. And as much as this episode is going to be possibly a celebration of therapy, because it's something that I love and it's something that has done wonders for me, I think it's also important to acknowledge the fact that in the wrong hands, therapy can be very damaging. And if you do not feel particularly safe, or you don't feel like it's a good fit for you, everyone is well within their rights to seek somebody else out. And I talk a lot about the power of the room when it comes to therapy, and the power of being in a room with someone who is listening to you. And that power and the imbalance of that power can be as damaging as it can be illuminating. So it can definitely go both ways in the wrong hands.
Absolutely. Well, perhaps that's a good segue to talk about who tends to use or benefit from therapy. And we'll just start out by saying there is a harsh reality around a lot of therapy, and that is, particularly over time, it costs a lot of money for most people. So particularly when you're looking at people who are usually highly educated and directly swap their time for money, it's going to cost. It depends on where you are in the world, but it's, several hundreds of dollars a session. Some people have access to funding, such as veterans or in countries with very socialized, medical systems, and some that have employment assistance schemes. But in general, if you're doing it private, which is generally the case, it's expensive. It's a real big investment. So you got to have money, usually, to benefit from therapy or have some sort of in.
Yeah, this is a big bugbear of mine in terms of therapy is generally the accessibility of it is quite high for a lot of people. And there are some good schemes. There's lots of charities who help people find counselors or therapists, but that's only up to a certain amount of sessions, most likely. And it's one of those, it's one of those big bugbears of mine, but especially when I see government spending on various other things, and I think we have all of these problems. Why don't we have a fully funded mental health sector where people can access affordable or free counselling or therapy? Because the other side of it is that counsellors, therapists are trained professionals or should be trained professionals who also have demands on their time and their money in terms of their own training, their own professional development. And it can be a very expensive space to be in. But yes, I will come down from my soapbox for now. I'll just place the soapbox in the corner. There is no doubt that I will get up on it at some point later on.
All listening politicians out there, please change the health system according to Richard Brown.
Yeah. Vote one, Brown.
The next thing that is really useful, and a lot of people who enjoy therapy tend to be what we call psychologically minded. You don't need to be this, but it's very useful. And what do we mean by this? That's people who have the ability to and enjoy discussing how their mind or brain works. So they use psychological terms, or they're able to talk about feelings and their reactions. They're able to introspect a little bit. And people that have that vocabulary might not have the ability to do anything with it, but if they like thinking about it and talking about it, they're going to get a lot out of going to see a therapist.
I think anybody who knows me knows that my favorite subject in the world is myself. So the ability to...
Everyone's, don't worry.
The ability to go and talk about myself for 50 minutes once every couple of weeks to really see where I'm going, or to talk about some feelings that I may have had which I didn't want to express anywhere outside the room has been life-changing. I don't say this lightly when I say that going to therapy has really changed a lot of the ways I think about myself, I think about the world, and some of the things that I have been allowed to feel and allowed to have expressed and allowed to have explored. Some things which are fairly common to most people, fairly common to the human experience, and also, things which have shaped the person who I am and exploring where they are. And I find that fascinating. And a lot of people I know would enjoy the therapeutic journey in terms of trying to, just trying to work a few more things out. Like, why do I feel this way? What are these driving factors that I have? Why do I have these relationships with certain things? Why can't I just express this way that I feel? Am I allowed to feel this way? And so on and so forth. So yeah, I have found therapy to be a whole wide range of things. It has been exciting. It has been terrifying. It has been very sad. It has been very empowering. And yeah, I think if you are that way minded, it could be a brilliant journey.
Sure can. And I'll just come back to something you're saying about, who doesn't like talking about themselves. And I used to think I still get a bit, self-critical or something about when we invest in ourselves. And when we spend time talking about ourselves, it's narcissistic or selfish. Now, I think that's a fundamental misconception. And yes, if you spend 3 hours a day talking about yourself with everyone you come across, yeah, look at that. Humans are inherently narcissistic. If you have a look at any baby, it's only interested in itself. And as
selfish baby.
Yeah, how dare they? It's all about them, whether they need to eat, go to the toilet. And as you get, older and older, even adolescents are well known for it. And that's a normal developmental process. And the reality is that many people have not had this opportunity enough in their childhood to really focus on themselves and understand themselves. And whether it's filling a gap or just going a bit more into understanding yourself for the benefit of others and your job in the world, then it's not narcissistic. In fact, you're doing the world and the people that are around you a favor. And, there's a bit of discernment or judgment to know that when it's going over the top. But if you're going to therapy and you can talk about yourself and you are benefiting other people around you, it's actually the opposite of narcissistic. So I just wanted to make that clear for people who were worried about the self-investment side of things.
Absolutely. There is a huge difference between talking about yourself for 50 minutes with a therapist and diverting every conversation that someone has with you back to yourself, or ignoring the point that you've made and then talk about yourself. Again, a wonderful point you brought up there in terms of the ripple effect of people going to therapy. I wouldn't say I'm a different person, because that's not what it's about. But I think the difference in me as a person since before I went to therapy, and, it's still an ongoing journey. This is the work. We're still there. I've become a better friend, I feel. I've become a better partner and now a better husband. I think that it's expanded my horizons, and it's allowed me to be a more, I don't want to say well-rounded, because that's not what I mean, but I think it's more empathetic, perhaps, more centered, less judgmental. And I think the most important thing is that it's allowed myself to be a lot kinder to myself. And, once you start being kinder to yourself, those things, it flows out. And I like to think that if people who have known me for a long period of time, I think that maybe they'd notice a difference between pre-therapy Richard and post-therapy Richard, but maybe that's not for me to answer.
Well, as a friend who's known you for at least half a decade, but possibly a lot more.
Yeah, I'd say a bit more. So. Yeah.
I feel like there's been some significant changes. Just putting it out there.
Yeah, definitely. A few sharp edges have been smoothed off, shall we say?
Yeah, I agree with that.
Yeah. All right.
Yeah, it's been lovely to see.
Thank you. I appreciate it.
And something that Richard always also has that is essential, and this might seem obvious to many people, but people that benefit from therapy have a reasonable working memory and vocabulary, because, in general, you got to actually be able to take things in, work with it, and discuss it. It's along the lines of psychologically minded, but it's not essential. So for people with, say, autism, any therapy can be adapted, the ones that are less verbal, people that are less verbal. But in general, if you're going to get the most out of it, people that tend to have, are quite intellectual often, get a lot out of it.
And I think that works both ways in terms of client and therapist, because there's been plenty of times when I've been stumped as to how I feel, and there has been some gentle prodding or the art of the question to tease out how I feel, or actually directly name how I feel. And any experienced therapist should be, have a wide range of tools to be able to do things like this. There has been many a light bulb moment, and I think I've talked about this before on this podcast, just the art of asking a simple question, or saying, I'm trying to think of this, there's a certain example I'm trying to think of, but I remember there was a particular feeling I had early on in my therapeutic journey where I just could not shake this really hardwired belief I had about myself. And and all my therapist did was ask, why do you feel this way? Or why does this have to be this way? And it was one of those real sort of like aha moments where you see someone, and I've been that person, and I don't know if you could speak to this, but you have something which is so hardwired and it feels so strong and so powerful. And just the actual art of the question of being able to say, how about, have you thought about it this way? Or why does it have to be this way? Can be absolutely, I don't want to say life-changing, but there are those things where it's just like, you know what, actually, yeah, it doesn't have to be this way, and I don't have to feel this way, and why do I have to feel this way? And what is it with the shoulds and the should nots and stuff like that? And for those who have not been to therapy, it might be like one of those things of like, oh, somebody says, how have you not felt, like, why do you not feel this way? Or why don't you think about it this way? And it sounds quite glib or flippant to be like, oh, they've asked me a simple question and it's like changed the course of my life. There are these things that a lot of us, this is not an uncommon experience, that a lot of us have these really hardwired thoughts and beliefs about who we are and about, what we should be doing. And just a simple challenge on it can just be absolutely mind-blowing. And that's all part of, the art of therapy. You have to know, your therapist has to know the right time when to ask this question, has to understand if the client is in the right frame of mind to be asked this question. And again, coming back to the power of the room, like being in the room with someone, especially if there's money being exchanged for this, and you're after a service, it's a very powerful thing.
I completely agree. And something that when a friend might ask you the same question, or someone that you're having debate with might ask you the same question, we can automatically reject it. But a good therapist will have established that rapport and trust where you will think about it in a different way, because you're there 100%. To change. You're not there to be in your ego and debate things. And the really good therapist can see you and validate you and allow you to meet yourself without things getting in the way.
Yeah, and that's the beauty of the therapist, or a good therapist, is that independence. A therapist is not your friend. Like, let's get this straight. You may, we can talk about transference and things like that, but, therapist's role is to be completely independent from you in your own personal life, but to hold that, we talk about unconditional positive regard for you and to have your best interests at heart, but in a completely professional and independent way. And that is, it doesn't transfer to friendship. I would hope I wouldn't act as a therapist to my friends in terms of, when they're going through times of troubles and things like that. I can be a supportive friend. I can be a good friend. I can maybe use some of the skills I've learned to, hold space for friends and things like that. But that's a completely different relationship.
Absolutely. And there are, it's generally not good to be the therapist for your friend as well. It's good to be friends for your friends. Not.
And I will, for any friends listening out there, I will rebuff you. There has been a couple of occasions where people I've known have reached out and asked for sessions, and I'm honoured for people to ask me for help in terms of like professional help, but ethically speaking, that is always a no. And these requests have been swiftly, rebuffed, but with care. And basically, for anyone who's listening who may know me, no, I will not provide you any therapeutic services.
The man has boundaries.
Absolutely.
Let's talk about another group of people who benefit from therapy a lot. And those are people who notice difficulty in relationship of all sorts. So whether that's with friends, parents, lovers, whoever, animals, whatever it is. If you have difficulty with that and it's causing a lot of strife, and you're having difficulty keeping friends or partners, or real issues with your parents, then Therapy, and particularly a longer term therapy along the lines of, I would say, psychodynamic therapy, which we'll talk about briefly in a while, but any therapy actually that can help you work through communication patterns is going to be useful. One of the reasons for this is that, well, first, it's unbiased, so you don't have all the difficult feelings that come in, and hopefully that trust can be established, and the therapist can actually work as what we'd call in a longer term therapy, a proxy attachment figure. And by that we mean someone that is like someone that's very close to you, like your best friend or your partner or a parent, and that we come to rely on and come to be one of the most important persons in our life. But then they can actually work with you in the relationship in a professional capacity to help alter you and identify those feelings that come up within those relationships. So it's a very powerful method to look at how you relate to people. And if you think about it, that's probably the source of most sorts of pain, like rejection, sensitivity, anger, rage. It's all coming within relational things usually, or bosses, at work. Very useful for that.
That's the name of the game. Interpersonal relationships, no matter who they are with or the lack of them, that tends to drive people to therapy. It goes back to the crux of who we are as humans and what we crave and what we desire and what we need, and those strong personal relationships. And when those break down or deteriorate, or they are no longer there, or there are trouble in them, then this is where the good work can be done. I think over the course of my therapeutic journey with my own personal therapist, it began with a divorce, and we went through the whole gamut of emotions of a marriage breakdown, meeting a new partner, the fear, all of the things that go with that after a relationship breakdown, interpersonal difficulties with work, with my family, with friends, leaving a career, starting a career, grief and loss, the feelings of, distance from family. It's all been there along the journey. And not to say that, my therapeutic journey is my own. And I'm not to say that is what everyone's is like, but I feel like, these are not abnormal, very common themes. And I'm not special in terms of these things. But yeah, it's one of those things. This is what brings us to the room. I love therapy so much. I'm not only a therapist, but I have an individual therapist, and me and my wife also go and see a couples therapist. My wife's a psychiatrist, she's been incredibly supportive of my own career, but is also just hugely into therapy. It's the game, isn't it? And, you say to people, oh, me and my wife, we're going to see a couples counselor, or we're going to see a couples therapist. And people's immediate thought is like, oh, like, what's wrong? Are you going to break up? Are you in trouble? Like, it's been, a very useful experience, and it's helped deepen our relationship, if anything, because the process of going to a couples therapy, again, it gives us that space to discuss things which we may not be comfortable talking about in our one-to-one daily lives. And it's another thing where the beauty of being in the room and the beauty of having that space and having that other person in the room with you to not to mediate, but to, hold the space and to maybe ask some questions that need to be asked, or prompt some things, or direct a conversation, it's been really powerful for both of us. And I don't think I'd be talking out of school if my wife hears this, but some of the things that we've discussed in the therapy room have been one of those things where we could not have a conversation about them. And me and my wife are very, we love spending time with each other. We're very close. We talk all the time, blah, 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 all that good stuff. And yeah, but there were some certain things where we could not get past. And to go and explore them in the room was, it wasn't comfortable at times, but it was very valuable. And there were times where, I always think the best therapy sessions I feel like I've come out of a, high intensity training class. I'll be like covered in sweat and feel like physically drained because, we've gone to places that needed to have been gone to, but their work has been hard. It's been fantastic for us.
And it's along the lines of, I think people that feel like they or come from backgrounds where they haven't necessarily been heard or could not feel safe to say anything. I don't know if that's relevant to you and your wife's experience as well, but it really, that's where it can be very powerful. And
Absolutely.
you can bring things out that are like deep hidden. You can bring them out into the world and you can feel safe, and it actually makes it better.
Absolutely. I think those things, again, those misconceptions people might have in terms of like, oh, people who go to therapy are maybe, from damaged, like they're damaged from their upbringing and things like that. And, we can say things like that. Everyone has things from their childhood which has shaped them and influenced them, stuff like that. But, I think about the themes and stuff that I've gone through, or some of the topics that I haven't been able to breach outside of, until I've brought them up in therapy. And it's come from places where I've not felt like I've been heard, or I've been too scared to say stuff, or I've been brought up in an environment where we didn't talk about things like this. Again, these aren't uncommon themes. These are things which a lot of people, especially people of a certain age, would have gone through. If people's parents of, post-war generation and stuff like that, where people, didn't speak about things like this, or if you come from certain parts of the world where, men don't talk about their feelings, or families don't talk about, kids' feelings and stuff like that. And it's a profound thing to be heard and to be listened to.
Sure is. Just finishing off this topic of who tends to benefit. I don't want to gloss over this too much, but we will keep it relatively short. But anyone with a mental health condition. So basically, there are therapies that are evidence-based for any type of mental health condition, from what might be seen as a less severe, like a mild anxiety, all the way through to really severe things like schizophrenia. There are therapies out there that are going to benefit you. They don't necessarily cure it, but they can reduce symptoms and make your life better, and that's what it's all about. So if you have a mental health condition, just know that you don't need to just take drugs or deal with it, that therapies are out there, and getting the right kind of assessment by a clinical psychologist or a psychiatrist and getting matched up to an appropriate therapy is going to be a super good thing if you can do that. And finally, people that are just simply curious about their mind and want to explore. So you don't need to have something wrong with you, or to have, I shouldn't use that kind of terms, but you don't need to have a problem that needs fixing. But if you want to expand your mind, then therapy can be great. So I'd highly recommend it. Like if you need some additional help with work, like you want some more creativity, or you just want to explore some topics or practice some things, many therapists will love to hear you, will love to have you, because they have problems that are there all day long. And so if they've got someone that just wants to explore and maximize what they already have, then they're going to probably really appreciate that.
The analogy I like to use, and again, this is coming from a place of, if one can afford it, is, we have personal trainers for our physical health. And the therapist can play the role of personal trainer for, if not your mental health, but at least your thinking, your mental capacity. And I think it can be a hugely important part of people's lives if they can, utilize what therapy has to offer.
Yeah, absolutely. People often think that maybe it's just coaches that do that, that there's something that, personal trainer, the mind personal trainer is like a development coach or a life coach or something, but it's not. Like, obviously coaches are great in specific areas and can help you with your life, but also therapists can do this as well, and they have specific skills. And this is someone who, I'm talking as a coach and a therapist, that both have excellent things to offer for almost everyone.
Absolutely. That's some of the most important skills I've learned in my life have been taught to me in the therapy room. And maybe there's things that I've taught myself in there, but it's also something which has changed the way that I think about a lot of things outside the room.
Yeah. Yeah. Maybe it's a good time, I can talk about my own development of thinking in this area, that, I'm a psychiatrist, and I went to therapy for about 10 years, but I never necessarily expected that would be the case. I think my first interaction with the therapy world was when I was probably 10 or 11 years old. And
right,
when my parents divorced when I was 9, I developed psoriasis, so like a skin condition. I didn't put the two together at the time, but I started to get the skin condition. And of course, I was young. I didn't really realize anything. I was seeking medical treatment at the time. Creams, tablets, nothing seemed to work. And then I don't quite know why my dad did this because he's very scientific, but we went to a homeopathist, or a homeopathic specialist, and the treatments that she gave me didn't seem to really work, but she listened to me in a way that I've never been listened to, it felt like. And I remember the relief after that session, how amazing it was. And I felt just like everything, like my anger towards that divorce just settled down for a few weeks. It was just a very, profoundly opening and expanding and relaxing experience that did have an effect on my skin for a short period of time. I continued to struggle with skin conditions all through my teens and into my 20s, but I went to medical school, and in medical school they talked about psychodynamic therapy, and I had worked away at some things, with diet that had helped my skin, but I just had this hunch after looking a bit into psychodynamic therapy and how different people with different conditions don't necessarily have a simple physiological explanation. So one of the reasons why I started to go to therapy, just because I was very interested in the unconscious mind. I went, I think, in my second year as a psychiatry trainee. I was recommended to go to someone locally, and I told her that this is one of the reasons why I want to go, working through some other things as well. But it would have been within 3 to 4 months that my skin condition completely cleared up.
Incredible.
And it was very powerful to me to happen. I continued to go to see this therapist for 10 years. And so I've really only stopped it this year. And it helped me in my work, it helped me in my personal life, it helped me really in everything, working towards what kind of goals, the life that I live now. And giving me, I talked about that proxy attachment figure. I still think about things that she says that help me. I've internalized and helped me with my life. So I've almost, she would reject this, but many people say that it's in some ways a reparenting. And, kudos to all parents out there. It's a hard job, and damned if you do, damned if you don't. Kids are going to have some resentment towards you. So this is not hate towards parents, but it can be really useful to have another quote unquote parent in there that can help you along the way and fill some of the gaps that weren't, given to you initially. So it's been a very powerful experience for me.
Oh, well, thank you very much for sharing that. I don't think I actually knew that either. All of these things we're learning about each other along the course of recording these episodes. Shout out to all the parents out there. I think it's one of the big themes in my own journey has been working through stuff that, these internalized beliefs that I'd had, and talking about, family of origin, all of these things that completely shape who we are. And a lot of that has been, me working through with my therapist what these beliefs are, and also, allowing me to think of my parents as two human beings as opposed to my parents. And thinking about, how, did they get everything right? No. Does any parent get everything right? No. Were they doing their best? Yes. Was that good enough? Mostly, yes. Again, it's almost labouring a point to talk about how profound having that space is to work through this stuff. But who else are you going to work through this stuff with? I'm not going to sit down with my parents and say, hey, well, what about this? Hey, well, maybe I could have done with a bit more times. Is that realistic? No. Is having someone who's independent and who will listen and will maybe, actually allow you to feel certain ways that you may not have been allowed to feel before. Is that important? Absolutely.
Absolutely. And it can also empower you to have discussions with your parents that you've never had before, and or come to a place where you accept that they're not capable of that and you don't need to have that conversation.
Absolutely. And that's not to throw shade on my parents or any other parent out there. I think for the most part, not in every case, people are just doing their best.
Yeah.
And that's all we can ask for. And again, I think I'll talk about it at a different time. I won't talk about it now, but I had an experience in my life when it haunted me for about 15 to 20 years, I'd say. Probably 20 years it haunted me. And I had never even spoken about it outside of the therapy room. And even then, it took me about maybe 2 or 3 years of being with my therapist and seeing her regularly that one day it fell out. Like, I remember I blurted it out. It just almost fell out of my mouth. And I couldn't believe that I'd actually said it because I'd never said it to anyone.
Had such a hold over you.
And it had this incredible, this would be 15-hour podcast if I really went into it. But yeah, this thing had a vice-like grip over me. Had a really vice-like grip over me, and it really haunted me. And I remember the day where I actually said it in front of my therapist, and I broke out in this huge sweat, and I couldn't believe it. And she was quite surprised when I told her, because we'd been seeing each other for a few years. But then we worked on it, and we worked on it, and we worked on it. And sometimes she would, if I was talking about something else, or she would gently bring it up from time to time, and we would work on it. And through the process of this, wasn't an overnight process, but through the process of this, I reflected on my life at that time. I reflected on my life now, and we really worked on A, me like forgiving myself, and B, like me showing like huge compassion to who I was at that time. I'm going to be clear. I didn't do anything like murder anyone or rob a bank or anything illegal.
Yeah, man, you're killing us, not telling us what this is. I know. Like just dangling this freaking thing in front of us. Go, yeah, but no.
And this is the thing. This is something which I'm coy when I'm talking about it to other people, because it's something where I have only over the last few years recently reckoned with it myself. And not even, I say reckoned with it, but like I've only recently, explored it and discussed it. But to get back to the point of it was that whole thing of, the skill of my therapist or of therapy, the art of therapy was I was able to, in a really safe and comfortable environment, while I was never pushed too hard, it was always as gentle or as pressing as it needed to be. But I was able to really think about myself in a compassionate way, which I hadn't been able to do that in my life. And I was able to talk about myself at that time and talk about what I had going on and talk about what supports I maybe didn't have and I could have had. And I was able to really think about myself when I was younger and feel like, Richard was just doing his best. And it was, I feel quite emotional talking about it now, but it was that act of being able to ask, like, what did Richard need at that time? What didn't Richard get at that time? What would you say to Richard now? What do you think Richard would think of you now from back then in terms of where you are in your life? And again, it's one of those things where if you don't have the right person, if you don't have the right space, if you don't have the level of trust, then this isn't something which just happens. But again, it speaks to the power that the Therapeutic Alliance can have, because this was something which I hadn't spoken to anyone about. And I think I have probably only ever spoken to my wife about now. And it was, and now here I am talking about this elusive thing on a podcast. And when I think about, my going on 8 or 9 years in therapy now, like that has been one of the huge things which has really sort of released the power of, what this thought and what this had over me. And isn't that what it's all about, taking the power away from negative thoughts or feelings about yourself?
Yep. About getting that freedom back and not allowing those things to dominate our lives. And it can be often a subconscious thing too.
Absolutely.
Completely hear that. Congratulations on sharing that and getting that out.
Thank you. Yeah,
Well, I do want to hear what it is, so maybe you'll need to tell me afterwards.
Maybe.
Okay, let's get on to the pros and cons list. I'm going to really summarize it because we've actually talked about it. I'm just going to do one or two words things, but I would feel empty if we didn't do it. So I'm going to do it.
Pros and cons.
Pros and cons. All right. Pros. Most or many therapies are evidence-based and have been in use for a long time. Neuroscience shows that change occurs most effectively in relationship, and therapy is a wonderful place to do that. Therapy is generally safe, and so get recommendations and follow your gut. Occasionally it's not if you get the wrong therapist. That's why you got to follow your gut.
Yeah, I'll quickly talk about not getting the right therapist.
Let's do that in cons.
Let's do it in cons? Let's do it in cons.
Yeah, or how to get therapists. They have institutional backing and codes of ethics. And that's, unlike many coaches who don't really have that. Therapy is also a great place to feel free and to talk about absolutely anything. That's pretty much it. So cons, it costs money a lot of the time, and also beware if it's too cheap. Therapy takes time. Like we've just talked about, Richard's been in it 7 to 8 years. I was in it for 10. Doesn't need to be that long. It can be weeks even, but it does generally take time. It's an investment. It can take a while to find the right person for you. And it's why some people say they don't like therapy when in fact they haven't found the right therapist.
So this is where I will jump in on this con. I've extolled the virtues of my therapist who I've been with for 8 years, and I've been very fortunate to work with her for the last 8 years. But that wasn't my first experience of therapy. My first wife and me went to see a marriage counselor, and he was terrible. And I'm trying to sort of remain professional when I speak about these things, but he wasn't equipped for the role that he was playing. And he dished out unsolicited advice, which is a very dangerous thing in the therapeutic space. And I was very fortunate that I was able to, have that experience where I went back to therapy and it was a positive experience. Again, you have to find the right person. Not all therapists are equal.
And a parallel point to that is that typically the type is less important, but sometimes a particular therapy can be damaging for someone or hinder their progress. So it's good to try and match things up. And that's why we're going to recommend getting an assessment and recommendation for your particular thing. And there is the risk, and this maybe was happening in your case, of therapists living out their own wounds. And unfortunately, it's good to know what training people have, what sort of peer review mechanisms they have, what supervision they've had, and to get recommendations from people, because often it's an unconscious thing, but if you don't have enough training or self-awareness, and therapists, for instance, if they are feeling lonely or they had an issue in their divorce, then they might be projecting that onto you. They might be seeing people for their own emotional comfort, or they might be giving advice that's only relevant to them and they're not able to see you for who you are. And that is something that happens probably more than would be ideal.
Absolutely. And again, it's a very important and precious space, and it can cause damage if the therapist is not, correctly trained or correctly supervised, or does not have the level of self-awareness to do the job.
Yeah, absolutely. It's a real danger. We haven't actually talked much about different types of therapy so far. Whether I have a list or not, I'm not sure. I wanted to go into 3 different types. I think it gives a nice little maybe overview of a few popular types. There's cognitive behavioral therapy, there's psychodynamic psychotherapy, and then there's attachment-based therapy. There are a whole bunch of others, and I'll just quickly use the words just so that you're aware of them. But again, there are hundreds of types, but there is, as I mentioned earlier, EMDR, which is eye movement desensitization and reprocessing. That's usually for trauma. There's dialectical behavioral therapy. You're just going to have to look these up, but that's typically for distress tolerance, sometimes for what we call borderline personality structure. Then there's mindfulness-based cognitive therapy, often very good for depression. There's schema therapy, acceptance and commitment therapy, where you might look a bit more at your sort of values. Internal family systems therapy, and there's just a whole world of family therapies looking at families themselves. This is more just for an individual, but recognizes that we have different, it's very popular at the moment, recognize we have different parts of ourselves. We're like an internal family. I could go on and on. Richard, do you want to name any others that come to mind?
Well, they're just individual ones.
Yeah.
When you get into couples therapy, we've got the Gottmans, and then, the individual, thinking more of the individual therapies. Bit out.
There's something for everyone anyway.
Yes.
I'm just going to, yes, I've got some scenarios, and I just want to, for those of people out there that really don't know what therapy is all about, I'm just going to talk through CBT firstly, because that's the most popular one out there. It's commonly known as CBT, but it's cognitive behavioral therapy, and it's probably the most widely practiced and evidence-based psychological therapy. It focuses on identifying and changing negative thought patterns and behaviors. It operates under the premise that our thoughts, feelings, and actions are interconnected, and by altering the way we think about situations, we can influence our emotions and behaviors. And so in CBT, clients work collaboratively with therapists to recognize distorted thinking patterns and contribute to emotional distress or maladaptive behaviors. And by challenging these distortions and replacing them with more rational and balanced thoughts, individuals can experience improved mental well-being and make healthier choices. That's often structured and time-limited and makes it effective for treating a range of issues such as anxiety, depression, phobias, and even stress management. So I'll just give an example. It's a made-up example, but a pretty common one. Sarah, a 30-year-old professional, has been struggling with generalized anxiety disorder. She constantly worries about potential negative outcomes and often avoids social situations due to fear of judgment. Through CBT, Sarah works with a therapist to identify her anxious thought patterns and the underlying beliefs that fuel her worries, such as the thought that she will embarrass herself and will be laughed at. And with guidance, she learns to challenge these thoughts by examining evidence and considering more realistic perspectives. And over several sessions, Sarah practices techniques such as cognitive restructuring, where she replaces irrational thoughts with balanced ones. And as a result, she gradually gains the confidence to face situations she once avoided and experiences reduced anxiety levels. CBT equips Sarah with the tools to manage her anxiety, enabling her to lead a more fulfilling and less constrained life.
Yeah, the gold standard in terms of, what you'll most likely encounter if you enter into therapy. Hearing
the domain
Brendan,
of the psychologist.
Absolutely. Hearing Brendan describe that and listening to my own personal tales of therapy in this session, you may notice some patterns in terms of thoughts and ideas that I had about myself, and how, the power, again, I feel like CBT gets a bit of a bad rap, even though it's like the gold standard of therapies. Again, I remember the first time my therapist said to me, "Where's the evidence to support that thought you have about yourself?" And it'd been like the lightning bolt coming down and hitting me.
And interestingly, CBT has lots of evidence.
Exactly. Well, there you go. And I see like this discourse about, CBT is just gaslighting, and come on, that's just absolute nonsense.
And in reality, many therapists will actually blend all these types of therapies. We're just talking purely because it's not, you might not look for one, but many are going to blend them just to be.
Yeah. I've always been a bit wary of people who are, just firmly in one camp and do not ever move from that. Some schools, maybe, I guess more psychodynamic therapists tend to just stay in their lane, so to speak.
Yeah, I don't know. That's true. There are some purists out there, but I think also that the best ones will typically blend it. Like modern therapies are going to be blended.
Absolutely. And I like to think that in my own work that I do with my clients, it's not just a one-size-fits-all approach, because no one person is the same who comes in the door. And I would like to think that there are things we can learn from all different approaches. But again, CBT, again, I guess if you're talking about if you are, if you get a referral from a GP to go and see someone for a certain amount of sessions or something like that, or if you're going to see someone in Australia, or if you have an employee assistance program and they tend to have a certain amount of sessions, you will tend to get, I would say that CBT is most likely what you will encounter because it's measurable. You can set different goals and things like that, and it can be used on a shorter period of time.
Absolutely. Let's look at psychodynamic therapy, which you're hinting at is somewhat Some might think of it as being opposite, but again, I think therapists are going to blend it. Psychodynamic therapy, or it's close to the psychoanalysis that comes out of the Freudian line of thinking. And it's rooted in the belief that our unconscious thoughts and early life experiences significantly impact our current emotions, behaviors, and relationships. And this therapeutic approach aims to explore these deeper layers of the psyche to bring about self-awareness and understanding. Psychodynamic therapy involves a strong therapeutic relationship where clients engage in free association, discussing their thoughts, feelings, and dreams to uncover hidden conflicts or unresolved issues from the past. The therapist helps clients interpret these insights, facilitating a greater understanding of how past experiences shape present-day challenges. It's a deep dive into your past and unconscious patterns. Unlike more structured therapies, psychodynamic therapy tends to be open-ended and delves into the complexities of one's inner world. It's particularly suited for individuals seeking to address long-standing patterns, interpersonal struggles, and gain insight into their unconscious motivations. And again, here's a brief example of psychodynamic therapy in action, not a real case. Michael, a 40-year-old artist, has been struggling with recurring feelings of emptiness and difficulty forming meaningful relationships. In psychodynamic therapy, he explores his early experiences, particularly his relationship with his emotionally distant father. Through introspection and discussions with his therapist, Michael realizes that his struggle to connect with others may stem from his childhood longing for his father's affection. By delving into these underlying emotions and recognizing their impact on his adult relationships, Michael begins to understand the origins of his emotional challenges. Over time, as he continues to process and make sense of these insights, he finds himself gradually opening up to others and experiencing a greater sense of emotional fulfillment.
Fantastic. I think this is probably what most people's idea of therapy is. You know, what we see in the culture, what we see in films, TV. Come in and lay down on the couch. Tell me about your parents. Tell me about your dreams. Here's a quick question for you. Have you ever laid on the couch for some work?
You know what? I sat and looked at that couch for 10 years because it was one in my therapy's office, and I always just chose the chair. I was never ready.
Yeah. We have my couple's therapist is, she's a couch. She's psychodynamic. And it was going from my own therapist to seeing her, it was very interesting going between working with two different therapists, two different styles. And one day maybe I will lie on the couch.
For a journey into the unknown.
Absolutely. Oh, God, let's not explore that iceberg.
Let's look at attachment-based therapies. Then we'll talk about how you might get into therapies, and we'll wrap it up.
Yep.
Attachment-based therapy draws its roots from attachment theory, which is very popular these days, which suggests that early relationships with caregivers shape an individual's emotional development and how they form relationships throughout life. This therapeutic approach focuses on examining and reshaping these attachment patterns to foster healthier connections with others. Attachment-based therapy often involves exploring a client's attachment history, examining how they relate to others, and identifying any negative patterns that may stem from insecure attachment experiences. The therapist works to create a secure and supportive therapeutic relationship that helps clients experience a healthier form of attachment, in a way, a type of reparenting. This therapy particularly effective for individuals dealing with relationship difficulties, low self-esteem, and emotional regulation challenges, as it seeks to mend past attachment wounds and provide tools for building secure and fulfilling connections. And the example is, again, de-identified, well, not real. It's Emma, a 28-year-old woman who's been through multiple failed romantic relationships and struggles to trust others. In attachment-based therapy, she examines her early experiences with her parents, particularly her mother's emotional unavailability during her childhood. As Emma works with her therapist, she realizes that her fear of intimacy and vulnerability is rooted in her past attachment wounds. The therapist creates a safe and nurturing environment that allows Emma to explore her attachment history and provides her with corrective emotional experiences. Through the therapist's consistent support and understanding, Emma learns to form healthier attachment and begins to develop more secure relationships. Over time, she gains the confidence to express her needs and emotions, leading to a newfound sense of connection and fulfillment in her relationships. And as you probably correctly thought there are a lot of crossover, and attachment-based does have a lot of similarities to psychodynamic therapy, but probably a bit shorter in general.
Shout out to my boy Winnicott.
That's it. The good enough man.
Absolutely. Yeah, I have a t-shirt which I have worn on this podcast before, which says good enough. And yeah, big love to old Donald.
How to go about seeking therapy? Well, the first thing is one size does not fit all. It's really going to be context dependent, like what funding's available in your country. There's going to be cultural differences, and just depending what type of therapy you're looking for. But one thing I would really recommend is, being a doctor myself, I would say go see your doctor first if you've got a particular issue, because it's really important to not overlook medical issues. And also doctors have usually really good directories and connections with therapists if you don't have one that you know you want to go to yourself. So just an example, someone might feel tired and depressed, and there are lots of medical issues for that, such as low iron. And it's really good to just get a check, because if you haven't done this, you could do 30 years of therapy and you're still going to be tired and depressed if your iron's deficient. So just do that first if there's some sort of issue, and then look for a recommendation either from the doctor or from, someone that you trust. That would be my first suggestion. And remember what Richard and I both said during this is that you might try a therapist and you don't like them. Don't give up. Go meet and greet therapist. Ask them, be very specific about what you want out of it, like whether you're prepared to do a longer term, whether you want short term. If you know of a type of therapy, one of those ones we've talked about today that you want, say that you want that. Be very specific, because you're going to get more out of it if you really trust the process. And also talk about the financial issues, such as how much is it going to cost, because that's really important. And can you get, is there any funding, deductions, or anything available?
Excellent points. In terms of my own practice, I offer potential clients a 15-minute phone call just to discuss what the actual issue is that they're looking to come to therapy, and see whether we're a good fit for each other, because I'm very mindful of the fact that I might not be what the person's looking for, and I could see if I can refer them anywhere else. There are plenty of different online directories. GPs or local GPs always a very good start as well. Like Dr. Doherty has said, I was very fortunate in terms of my own therapy that the company I was working for at the time funded, I think, maybe 6 or 8 sessions, and then I entered into, a private arrangement, and because I was finding it so beneficial. But yeah, there are avenues. See if your work has an employee assistance program. See if there are any charities that may assist with your counselling, depending on a wide range of factors. I know there are lots of good LGBTQI plus charities which offer counselling assistance and offer referrals to programs and things like that. So again, there is a huge world of information out there, and it can be quite overwhelming at times. Local directories may be good. I know that in Australia, I am listed on Psychology Today, and I have met a lot of my clients through there, have found me through there. And again, that's always a good way of seeing, is this person going to be a good fit? How old are they? What's their background? What's their experience? What are their issues that they tend to work on clients with? So, yeah. Do your research.
We didn't mention insurance as well. Often we'll be able to contribute towards.
Absolutely. Yep.
All right. Well, I think that about wraps it up. I hope that is useful for people.
Yeah, I just wanted to end this session back into my therapist mode, end this conversation with one point which I think is very important for people to hear about therapy. And as a therapist and as someone who has extolled the beauties of therapy, you might have listened to this and thought that it's the therapist who is doing the work in the room. And I wanted to leave this conversation by saying that you, the listener, you, the client, are really the person who's doing the work. A good therapist will facilitate these things, but ultimately it is you who does the work, and it is you who puts the effort in. And as with any relationship, you get out what you put in. And it's important to remember that, yes, the therapeutic work can be tough, but it's incredibly rewarding. And it's something which can potentially be life-changing if you allow it to be.
Thank you, Richard. Appreciate that. And it's a point well made that Whatever type of change you're into, there are very few things where it's going to be done for you. And therapy it takes time, but it's, one of the ways that we can say for sure that when done well, it works. And put it in the context of radical change, incremental change, and psychedelic medicines, all the things we've talked about so far. Therapy can work with all of those things, and it can work alone and in all sorts of environments. So you've heard it several times. We endorse it. Go out
Absolutely.
there and go
and
for it.
If you would like to hear more from me talking about therapy, keep an ear out in the new year, because I may have an exciting therapy project coming.
There we go. Nudge, wink, wink.
Yes, say no more.
Alrighty. Thanks again for joining us on The Self You Seek and this mini-series, Recipes for Change. We'll see you next time.
Take care of yourself.
Thanks for tuning in to The Self You Seek. I hope today's episode brought you one step closer to unlocking your full potential. If you found value in this conversation, I'd love it if you could take a moment to rate and review the podcast on your platform of choice, whether it's Spotify, Apple Podcasts, or YouTube. Your feedback helps us grow and reach more people on their journey to self-actualization and mental optimization. And remember, this podcast is just the beginning. It's meant to inspire and empower you, but it's no substitute for personalized advice. If you ever need guidance, always reach out to a licensed healthcare or mental health professional who can support you on your unique path. Until next time, keep seeking, keep growing, and take care of yourself. I'll see you in the next episode.